create a revolution of positive, transformational experiences through acts of kindness. I'm hosting a series of live interviews Monday through Friday with leaders in our community that are doing just that. Tonight, I'm very happy to introduce my friend Legia Romera, who is with the Lansing Area AIDS Network. Legia, thank you so much for taking time out to join us.
Well, thank you for inviting us.
Legia, remind people what the Lansing Area AIDS Network is and what your mission is.
So Lansing Area AIDS Network is a nonprofit organization that's been in this area for the last 35 years. It started with just the planting of a seed, by two individuals, Maxine Thome and Bloke Doss. In 1985, they just wanted to have a safety net for those individuals that were being diagnosed with HIV, and it's still here. We're still here, and I think
when you talk about that, it's still here. We don't hear about it as much as we used to. Is it really that prevalent?
It is. I think I feel that why we have drifted away so much about talking about it is that we have good treatments, we have good medications now. And there's so much stigma behind it, Bob. There's still a lot of stigma, and no one really wants to talk about it still. But the good thing is that good medications, people are living longer. So those are the good upside things,
Talk a little bit about how COVID-19, another pandemic that we're dealing with really now, that's all over the news.
Yes.
How has that affected Lansing Area AIDS Network?
Well, we're an agency that is so hands-on. We have our clients come in, we have our clients access our pantry, we have our clients come in and meet with their case managers. And since this COVID-19 has been in the last couple of months, we've had to just keep our clients away from our agency. On a lockdown, we've had to support that to make sure that our clients are staying healthy, that we're staying healthy as we're continuing to provide services. So I think that's been the biggest challenge that we have had, not having that face-to-face, one-on-one contact with our clients. I think that's the biggest challenge that we have had.
I know that you have a food pantry, so how does that affect the food pantry?
Well, we've had to step out of our box. It's always been where clients come in to the agency and they come and get their food. So I know that our clients still need food. So we got into the delivery process. Clients call in, they tell their case managers what they need, and we're now in the delivery. We're doing deliveries every other pantry, which is the second and fourth Thursday of each month. That's what we're doing now. And I think that the piece that's really good about that is that we're seeing so much gratitude from our clients. The gratitude of just having them say, listen, thank you for bringing food. That's so much for us. It's powerful. It's really powerful.
People are getting tested right now for the COVID-19 antibodies, but are you still doing testing for HIV?
We are. Nuaya is the prevention coordinator, and we're having testing here at LAN by appointment. And we also have testing on the north side at Diversity Psychological Services. So that's ongoing. It's free. And it's 15 minutes. In 15 minutes, you can get your results, which is so much better than what it used to be, which is you would come in and then 2 weeks later, you're waiting for a result still. That's nerve-wracking. So testing continues to be part of one of the services that LAN provides. I'm very proud of that. We're very proud of that.
You talked about this being a stigma with HIV and AIDS, and when it first came out, it was, all gay men were getting it. But now you see the population is absolutely everyone, right? It doesn't discriminate.
It is. It doesn't discriminate. You know, it doesn't. Women, youth, um, straight. You know, it doesn't. It doesn't discriminate, unfortunately. And but we're here. We're here to provide the services. We're here to provide the testing. We're here.
And that's the good news that I wanted to get across. And
Yes.
it's been in existence for so many years, helping so many people. And I know that you rely a lot on volunteers.
Yes, we do. Yes, we do. And that hasn't changed either. You know, we have volunteers for the pantry, faithful volunteers for the pantry. We have faithful volunteers to answer the phone. We have an army, a little small army of volunteers that follow us when we have activities outside in the city, you know, and we've been blessed to have that still. You know, we wouldn't be able to do it without him, without the volunteers.
Well, I just want to say thank you to everything that you do and Lon has done for so many years. You've really made such a difference in people's lives. And Legia, I ask everyone the same question at the end of the interview, and that is just, can you tell me something good?
Human services. Human services and being able to serve people. And I have a quote, if you don't mind, and that is, the way to find yourself is to lose yourself in the service of others. And that's what Lon does.
I love that. That's awesome. Well, thank you, my friend. And thank you to Lon.
Thank you.
You're changing lives for the better, and we appreciate it.
Thank you so much. Appreciate it.
All right. And of course, if you want good news, go to epiphanynow.org. We are always sharing good news. And we'll be back next week with more leaders in our community. We'll see you on Monday.